I'm Chet Billingsley. Today's question is, are we losing more life because of COVID-19 or because of the lockdown? Looked around today, I see all sorts of action being taken to prevent something that seemed to be not as bad as it was in the past. Really not much different than just the seasonal flu season last year. These numbers are all adjusted as if the population for just the United States was the same as it is today, and these are the deaths that occurred during these periods of time. You see that in 1957, the amount of deaths were almost twice what it is today, and half again as much in 1969. Why weren't we taking those preventative measures back then? Or are we taking excessive preventative measures now? And we'll look at that question. And in order to answer that question, why are we acting like we are, closing everything down, using social distancing and masks and so forth? We look at what happened just a few months ago in March 2020. At that time, people were saying that there would be 2.2 million deaths in the United States. That's extraordinary. That's as many as they were in 1918 when the Spanish flu came through. 2.2 million deaths would mean that at every high school graduation of 900 people, there'd be 4 students that had passed away. And back home, there'd be 8 more parents that had died. And in the neighborhood of 50 people, 50 homes, there'd be somebody that had passed away. And you'd look out your door and say, well, over there, Charlie died, and over here, Mary died. We don't have that circumstance at all, thankfully. They did in 1918. And policy is being set as if we're having 2.2 million people are going to be dying in the United States. We would take extraordinary steps if that was the case. But how did we get to a projection of 2.2 million deaths when we have so far less? And the first mistake was there was bad numbers coming in internationally. Those bad numbers were fed into some folks making projections, and there was bad science applied. Now, I say there's bad science applied and bad projection as a science guy, dating back to my years at Harvard and MIT. Right? And whoever came up with the figure of 2.2 million, and we know who it is and who echoed that, they should hang their heads in shame. That those bad numbers and bad science set up policy that is reasonable to respond to 2.2 million projected deaths. And politicians, perhaps, that are more on the social science side of things or the English side of things, maybe we can't blame them for accepting the input from science at that time. However, within a month, the number of projected deaths had dropped down to about 240,000. Even though the amount of deaths went down by a factor of 10, the policy stayed the same. Later, the amount of projected deaths went down by another half or more. So today, we're looking at 1/20th of the deaths. Maybe 990,000 is a more realistic number. But we're treating our economy as if we had 2.2 million deaths coming down the pike. And actually, there's another factor here that brings it down even further. Just because people are wearing masks, doing social distancing and so forth, doesn't mean that we're going to save every single person. In New York City, 66% of the people that had the disease followed the rules and did everything correctly, and they still got sick. So you can only save about a third. A third would be about 30,000 people saved. Might be 30 to 45,000 people, depending upon how you look at it, but we'll just use 30. So all of our efforts might save or have saved 30,000 people. Well, 30,000 people is a lot. And we have to ask ourselves, is saving 30,000 people worth all the shutdown? And in doing that, we have to try to make an apples to apples comparison. Because we've heard talk of people committing more suicides, people not going in for their cancer checks. We know in Chicago, if there's not heating in the winter, enough heating, people will die. In Phoenix, if there's not enough cooling, people will die during the summer. So there's many different ways that people can pass away when the economy is suppressed. And the government has looked at that for transportation, environmental issues, and medical programs. And what they've come up with is that an average life, for the amount of years that we're talking about here, for people losing their life to COVID-19, costs about $5 million. So $5 million represents an economic life, a statistical life. And what we mean by that is if you take $5 million extra dollars and put it into the economy in a positive manner, you're going to save on average one life. Conversely, if you take out $5 million, you'll cost a life. And you can think of this and verify this in your own mind with a thought experiment. Imagine you took your inexperienced niece and gave her 100 packages of $50,000 each to give out to 100 different families with about 3 or 4 people in the family. And to do that 100 times over to 100 different families, that 50,000 over 100 families would probably, it seems reasonable to me, would save at least one life. Conversely, if you could reach out and grab $50,000 and pull it out of 100 families where their income used to be $60,000 a year and it's dropped to 10, then that could cause at least one life out of those 100 families to be lost. So it seems a reasonable number and fits with the way the government calculates things. This idea that for every $5 million that is taken away from society, you're going to lose a life somehow. People have talked about this qualitatively, and we're trying to turn it into real numbers. The government also says that so far we've lost about $1.2 trillion in earnings because people are sitting around. That's going to coast up to about $1.5 trillion before this is all said and done. So let's take those two numbers and compare them and see how many people are sacrificed in the long run by the lockdown. Well, we've got 1.5 trillion divided by 5 million. 5 into 15 is 3, and there's 1, 2, 3, 4, 5 zeros. 300,000 people have been sacrificed by the lockdown, some already, some soon because of foregone medical issues, some because they gained weight, others because they won't have enough money later for the economic benefit of their family. So 300,000 people have been sacrificed, and remember we said that 30,000 could be saved. So we're sacrificing 300,000 with the lockdown to save 30,000 people. This is a terrible outcome. It's 10 to 1. And it's proceeding if we have 100% lockdown across the entire United States at a rate of 100,000 per month. So a question is, well, we're brought to this point, and we understand, we can compare it to history and see that it seems a little overboard compared to history. We see how we got there by bad numbers, bad science, and just sticking to the same policy as if we had 2.2 million deaths coming up, which we don't, doesn't make any sense. We should change. So what should we do next? And the first thing is we should reopen 100% now. If we only reopen 50%, as some people might say, well, we want to go at this cautiously, well then you'll be sacrificing 50,000 lives per month. Remember, it's always proportional. If you did only left a quarter closed, well then you'd be killing off 25,000 people per month. So no percentage should ever of the lockdown should be left in place, because although it can save some lives, we sacrifice 10 for every one that we save. We didn't do that. We didn't have this sort of action in any prior pandemic except 1918, but then you'd be saving 7 for every one you gave up. So that makes sense. If we had 2 million lives being lost, it would make sense. But it makes no sense when we're only saving 30,000. We should finish the vaccines. In 1957, Maurice Hilleman heard of the pandemic starting in Asia in about April of 1957. He immediately jumped on the idea of producing a vaccine to prevent the epidemic from causing the loss of many lives in the United States. And in 4 months, he had developed a vaccine that would work. In his words, he said he had to make sure he went around the government because they could never get it done in time. We seem to be doing the same thing, which is beneficial. Put things on the fast track, get the vaccine done, and the vaccine will be a mild version of COVID-19. That mild or weakened version will cause a mild antibody reaction within the people. And then if the real virus shows up, those antibody producing cells will jump to the fore and squash the virus and keep people from getting the disease. That's how antibodies have worked for every virus that it's been used for. A third thing that we've seen that's different for ourselves culturally is it would be a good idea for us to voluntarily use masks like they do in Japan. They had a very low infection rate because anytime any of the Japanese get sick, they, as a courtesy, wear a mask. And they often go into work sick. They don't feel that that's a problem because courteously they wear a mask. That should be should become an acceptable way for people to behave in the United States. Not necessarily to go into work sick, but to wear a mask if they have just a little cough, the sniffles, whatever it might be, wearing a mask is good. It's just like when people cough into their elbow now instead of coughing into their hand as they used to decades ago. The last is we should reduce fear. This continued echo of the pandemic era and screaming that you have to wear your mask or you're going to kill the entire neighborhood is ridiculous. This is just a little bit worse than a normal flu season. It's less than half as bad as it was in 1957. And I was there, even as a young tiker. I've never seen anybody running around with masks on. It's not as bad as it was in 1969. In all of these eras, we have never taken these extreme measures. You quarantine people that are sick not everybody that's healthy, and that should do it. So reducing the fear is important, and we try to do our part in that. We have a nonprofit called Antibody Badge. If you get a vaccine, then wear a badge like this. The vaccine tells people, or will tell people, that you have the antibodies, that you can't catch the disease or pass it on to them. That's what vaccines do. That's why we have them for all sorts of things. A super vaccine is not having a weakened form of the virus introduced into you, but when you get the disease itself. When you get COVID-19 and you fully recovered after a couple weeks, the antibodies have kicked in a couple successive waves, and you should be as safe as if you had gotten the regular vaccine maybe a couple times over. And we invite you to look at the antibodybadge.com website and see if this makes sense for you, for your company to supply to your employees that can contact us, or even for labs to give out to their people that they test to be positive, or governmental agencies or units like a city or a county that says anybody in this county that wants to can get a badge by showing that they have the antibodies. The button just says COVID-19 antibodies. So I hope this has helped you some in understanding the answer to the basic question that you can pass on and ask your friends. That basic question is, should we continue to kill 10 to save one life? And I think the answer to that is obvious.